All right, good afternoon. Hello, everybody. Hello. This is a great crowd. I like this already. Welcome. Thank you for joining us today. I'm very happy, one, that we've all had an opportunity to defrost over the past few days, but that you're all here today to join us for what is truly going to be an awesome conversation. I want to thank you for joining us for the 25th Barnes Lecture. This means that we've now had a quarter century of bringing in incredible experts to talk about the most important and relevant issues in public health, including the conversation that we're going to have today. This lecture series started in 2000 under the leadership of Vince Moore, who was the chair of the program on community health, and it has continued under the deanships of Dean Fox-Whittle, Bess Marcus, and now Dean Jha. I particularly want to thank Tim Zisson, who is here today, who helped, and his family helped set up this lecture series to honor Dr. Frederick Barnes. Dr. Frederick Barnes came to Brown in 1962 as one of the founding faculty for what has become the Warren Alpert School of Medicine. And he was enthralled with this idea of training physicians at a place founded in a liberal arts education, and set up a really apparently incredible course that was very inspiring to a lot of students. And many students remarked on how he was the quintessential physician scholar. One of his students, Jim Zisson, who is joining us here today, endowed the lectureship in memory of his parents because he viewed Dr. Barnes as this quintessential physician scholar. Mr. Zisson graduated from Brown with honors in 1974. And since graduating, his career has included entrepreneurship, an investment manager, the general manager of A&M Records, co-founding the Palm Healthcare Foundation, co-funding the Norma E. and Miles M. Zisson Comprehensive Breast Center of the Palm Beaches, and serving as a trustee on many boards. I would like to thank him and his family for setting up this lecture series for us today. Thank you, Mr. Zisson, Dr. Zisson. So today we're going to have an incredible opportunity to hear from some remarkable experts. And I'm going to start with Dr. Mike Van Rooyen, who's the director of the Harvard Humanitarian Initiative and the chair of emergency medicine at Massachusetts General Hospital in Brigham. Professor of emergency medicine at Harvard Medical School, and the Levine Family Professor of Humanitarian Studies at the Harvard T.H. Chan School of Public Health. Dr. Van Rooyen has led the response to many complex humanitarian emergencies, many of which I'm sure he'll talk about today. But the list is long and includes places like Somalia, Bosnia and Herzegovina, Rwanda, Iraq, North Korea, Sudan, Darfur, Chad, DR Congo, Democratic Republic of Congo, Palestine, Ukraine, just to name a few. Today, he's going to be in conversation with our own dean, Ashish Jha, the dean of the Brown University School of Public Health. Dean Jha is an internationally recognized, globally trusted expert on major issues impacting public health, and a catalyst for new thinking and new approaches in public health. A longtime leader on pandemic preparedness and response, from directing groundbreaking research during the Ebola outbreak, which has now been 10 years ago, to serving on the front lines of the COVID-19 response. He's led national and international analysis of key issues and advised local and federal policymakers, including a recent stint at the White House, leading the coronavirus response here in the U.S. So please join me in welcoming Dean Jha and Dr. Van Rooyen for an incredible discussion on humanitarian response. Thank you.
Right. All right, thank you. Oh, good morning. Good afternoon, everybody. Thank you, Craig, for that very kind introduction. Really excited to do the Barnes Lecture, and I was telling my friend Mike Van Rooyen, 3 years ago we had Paul Farmer as our Barnes Lecturer. I think it's hard to think of somebody who had more impact in global health writ large than Paul, and so it's hard at this moment not to think about him. 2 years ago, we had Gina McCarthy, who was the climate advisor to the president. Last year, when I was not here, we had Dimitri Daskalakis, who was running the MPOX response for the White House. So we've been blessed with extraordinary people in this lecture, and today is no exception. And I'm very excited to have my friend and colleague, Mike Van Rooyen. Mike and I spent a lot of time when I was running the Global Health Institute at Harvard, and he was running the Harvard Humanitarian Initiative, and is still running the Harvard Humanitarian Initiative. And I'm actually going to start there. And Mike, with each of these conversations, I think it's just helpful to hear a little bit of the background story. How'd you get into medicine? What's a doctor doing working on humanitarian stuff? And why do you need an initiative at Harvard to do this? So I'll let you get started.
Wow, okay, wide open. So first of all, Dean Jha, and thank you so much for this honor. It's lovely to be here, and really an honor to follow in the footsteps of really amazing people that you've brought to this lecture. So thank you so much. And Craig, thank you for a great introduction. Yeah, I mean, I grew up as one of 10 kids in mid-Michigan, and got interested in medicine early because my mom was suffering from cancer, so I spent a lot of times in hospitals as a kid. And just was, sort of fascinated by medicine, and was the first person in my family to go to college and go into medicine, and discovered that it was really wonderful. But I was really drawn to two things right away. One was, it was population vulnerability, to be there at the time when somebody needed you the most, right? And so emergency medicine fit with that because it was a time when I could sort of feel like I was going to grab somebody and save their life. It really appealed to me. And they're all ADD anyway, so it was a good fit. And right along the time when I was sort of entering into residency, I also wanted to sort of play the intellectual exercise of saying, what could I do really next to be the most involved in the lives of people when they need it the most? And the thing that I came up with is, in war and conflict is the time when it's the greatest sort of societal de-development happens and the greatest threat to people's safety, well-being, health, etc. So I was really moved by being interested in working in war and conflict. And then I didn't have any mentors, and I just started to find my way, and Craig will know this too, we find our way. And I just, very briefly, I was in Somalia, and I was a brand new emergency physician working in Somalia, and I will tell you, I had no idea what I was doing. I thought I was a decent doctor, but actually being in the field in Somalia during the war, super dangerous, super stressful, amazing needs, really difficult conditions, and I realized that I had no idea what I was doing, really no idea what I was doing. And so I worked there, and I tried to do the best that I could, but I looked around and I realized the humanitarian community, all of the doctors, the nurses, the structures, they were all noble thinking. They all wanted to do the right thing, and they were failing. And they were failing because the field had not professionalized. In other words, they weren't trained to work in Somalia, nor was I. I was trained to work in the US. And so the ability to actually understand the humanitarian system and to work in a setting like that was something that we're not training people to do. So I decided with humility and embarrassment, actually, that after that tour in Somalia, I was going to come back and actually really figure out what to do right, to do it better. And so I went to public health school. So I actually decided, I'm getting my MPH, I'm going to learn public health, and I'm going to blend it with medicine, and I'm going to explore this field of humanitarian aid, and someday, God willing, if I could do it, I'd like to build a humanitarian university, a place where people that are in this field can go and learn and understand it and contextualize it and be professionals in the field, in a field that had not been professionalized. So that's what drove me to do it.
So let's just stay on that for a second. So what does going to a humanitarian university look like? What are the sets of skills that a clinician who's really well trained in a hospital in Providence or Boston, what does that clinician not have that's so helpful in Somalia?
Yeah, thank you. And first of all, it's not just the clinicians, right? I mean, working in a humanitarian sector are all sectors of activity. They're food and water, nutrition, sanitation, housing, hygiene, medicine, as well as public health, of course, is probably the dominant part of the field. And so what people didn't know is, first of all, they don't know the structure of humanitarianism itself, who does what, how they do it, how they interact with each other, how they coordinate or not with each other. They also don't know really population medicine. That's what School of Public Health is all about, man. It's this population medicine and the idea that if you're a provider, a clinician, you have no idea about population health and what to do with it. And then working in the most dangerous, most access-constrained environments in the world is different. If you want to do a public health program or a health program in Tanzania, that's a challenge. If you want to do that same public health program in Yemen, it's a whole different thing. And so the idea of understanding the complexities of access and safety and organizational capabilities, as well as your own sort of what you can do, was really the education. It's the education that I'm trying to give my students.
And it seems like a big part of that is also understanding all the non-clinical actors, the organizations involved in all those other sectors that we in clinical medicine largely are not trained to engage with.
Yep.
All right, so I want to shift to the topic that is on everybody's mind right now. And come back to the fact that it's on everybody's mind and there are all these other issues that are not as much on people's minds. We'll come back to that. But the issue on everybody's mind right now is the humanitarian crisis in Gaza. And so from your hat as a humanitarian leader, expert, as a clinician, how do you see the humanitarian issues in Gaza now? And what is your sense? I'm not going to ask you to predict like what's going to happen on the geopolitical side of things, which is very, very hard. But how does this play out over the months and years to follow for the people of Gaza?
Just that. Yeah.
Just that. And can you do it in about 30 seconds?
Exactly,
Because I've got 12 other
yeah.
questions.
Exactly.
No, take your time.
First of all, my position as an individual and as a physician, as a humanitarian, as it relates to looking at what's happening in Gaza is not controversial. What I'm saying about that is that as a doctor, and as a healthcare provider, you have the ability to sort of simplify the issues in front of you. I will take care of any person, no matter what side of a conflict, no matter what uniform they had or did not have on. My job as a humanitarian physician is to take care of anybody right in front of me and to save a life. And in a population sense, my job is to save lives in a population scale, right? And so as it relates to, you can kind of, I don't know, hide behind it, but it is actually clarifying because no matter what the dynamics of the conflict are, no matter who's involved, no matter the complexity of the political situation that drives that conflict, my decisions as a humanitarian are clear. I'm concerned with the lives and livelihoods and welfare of civilians trapped in conflict. And that is not controversial. It's not controversial in Gaza, understanding the horrible impact and that has suffered the Israelis that were attacked and abducted, understanding that they're all individuals and really important individuals, understanding that the 34,000 plus Palestinians that have been killed in the crisis so far are all individuals. All of those people on either side, in either case, are actually critically important and important to the way sort of I think of it. The issue in Gaza for me is not a medical issue. It's not a public health issue. It's an access issue. The complexities of humanitarian access in Gaza right now are the sentinel primary issue that is causing mass-scale malnutrition and starvation in that population. It's causing lack of medical services to be available. It's causing the difficulty in any real formal relief efforts to get in, and it's causing the literal trickle of humanitarian aid that is getting into Gaza now. And my concern with that is, again, not disputed. It's actually the fact that we've got profound malnutrition of 1.1 million people who are trapped in a conflict and they're civilians and they need assistance. And so my approach to that is really, how do we do it? How do we get there? How do we provide assistance in all of the sectors that I mentioned, food and nutrition and healthcare, et cetera, and do it in a way that we can provide services in the middle of a really, really complicated conflict.
So building on that and the fact that it has been hard to get aid in, there's a broader trend that I think is not new to the conflict in Gaza, which I wonder if you can talk about, and then talk about how you think it might relate to Gaza, but which is this idea of the humanitarian space, that at least for those of us who are not deeply in it the way you and Craig and others are, the way I've always seen that is there is a space in conflict for humanitarianism, for humanitarian aid, for the workers, for protecting them. That humanitarian space feels like it has been shrinking for a while. So this is not the first conflict where it feels like that has shrunk. It has been shrinking for a while. So first of all, do you agree with that? Second, why do you think it's been shrinking for a while? And then I guess the most important question is, how do we stop it from shrinking and then ideally expand it, or is that even the right way to think about it? So if you could just talk a little bit about humanitarian space and what's happening.
Yeah. And you've said it really well, I think. The idea of humanitarian space is simply the ability to get access to populations and to work sort of unobstructed, or at least with minimal obstruction, and the ability to actually perform our duties. And, you know, I mean, I've been in the humanitarian field for 30-some years now. Somalia was at the end of 1991 when I was there, and so it's a long time. And back in the day, when I was a humanitarian worker, you could put a white T-shirt on that said whatever your NGO was, your non-government organization, Doctors Without Borders, Save the Children, CARE, Oxfam. You'd step in a white Toyota Land Cruiser, and you'd go through check marks because they knew that you were helping civilians, and that you were a civilian. That really started to change, actually, as the geopolitical dynamics happened, and the U.S. sponsored a number of conflicts, and the relationship between military action and political action and the linkage with NGOs and sort of humanitarian workers became more evident. That tangibly changed in my career. So, you know, 20, 25 years ago, if you were a humanitarian worker, the likelihood that you'd get killed in the field is really due to like your vehicle rolling over or a crash. Now it's by far and away the more likely thing is that you be shot, and not only just shot but targeted because you're a humanitarian worker. So, and we saw the World Central Kitchen people that happened as well. They were targeted, and so I think the idea that that humanitarian actors can actually get back to neutral is not going to happen.
And just so I understand, you think the shift happened because it became more evident that humanitarian workers, humanitarian organizations were more linked to political organizations or military organizations than we had appreciated in the past, or just help me understand that a bit better.
Exactly right. And so, you know, if you take areas where the U.S. military or Western military are moving alongside the humanitarians, you know, we have to be very careful not to be identified as the same, but we're somewhat seen as the same. And so before you know it, you are conflated, your presence is conflated with being a part of a political movement, part of a military movement, part of the same sort of undermining forces that are at work, right? And so even though none of us are military and we're explicitly civilian, it doesn't matter anymore. And so humanitarians are killed inadvertently because there's indiscriminate bombing, for example, but increasingly they're targeted because they're seen as complicit with the sort of political forces that are happening.
And is there a specific conflict or a specific moment where that shifted, or has it just been a gradual shift over time?
I think it started to happen. You know, Somalia was a really big one, and Craig and I both teach, and he'll probably think about this too, because at such a point there was a military humanitarian mission, and the U.S. advanced a military humanitarian mission in order to gain access, which turned into a combatant role. It converted during time. And so the NGOs and humanitarian aid organizations and the UN agencies that were getting access because of the military, in other words, we got access because of them, also were seen as complicit, and were all bunched with the same and forced out at the same time. So I think it seemed to start then, and it just really escalated. And so now if you are a humanitarian aid worker in Syria, Yemen, Myanmar, certainly Gaza, anywhere, you are at risk of being directly affiliated or directly linked to the military activities that are happening.
Is there anything we can do to turn this around? Okay, is there anything humanitarian organizations can do? Is there anything that the way militaries function can do? I mean, it does seem to me that the cost of war, which we tend to measure by sort of direct dollars and direct number of casualties, has always been known to be much, much bigger than that. And the thing that mitigates that is effective humanitarian response, right? And to the extent that we make the humanitarian space smaller, the humanitarian response less effective, the cost of war goes up. So what else can we do to recreate that, or is that?
Yeah, you said something interesting that I want to push on, because
And push back if you don't.
yeah, you know what? Because why is war? Humanitarian response is a Band-Aid. It is actually a Band-Aid on a wound. We are actually trying, and it's really effective. It can be really effective to save lives. Emergency food aid, we never hear about it, but emergency food aid saves millions of people a year. Cash assistance to people who are struggling in conflict, millions of people. It's really important, and it's important work that needs to be funded, but it is not the remedy. The remedy is a diplomatic solution, right? The issues in all of the conflict areas around the world, the 32 conflicts in Africa, the 15 or 18 in Asia, et cetera. The remedy is they're diplomatic solutions, and civilian aid organizations can't do that, right?
Yep.
So we can provide aid to get people to the next, to save people for the moment, but the remedy is actually access, and access is obtained by diplomatic solutions. And you said it really well. I mean, war is the great de-developer of our time, right? Nothing that takes a Syria that was like really advanced in so many ways and bombs it back 50 years than war. And so these are really military solutions, and you can't depend on aid agencies to sort of, make up for that.
I brought up Gaza because obviously it's the place that's getting all the attention. There's a famous line from the former founder of MSF that where there are no cameras, there is no crisis. Talk a little bit about, as a humanitarian, looking at the situation in Gaza, which has gotten all this attention. And again, not to downplay the very difficult situation in Gaza. How do you see two things, I guess, and they're related questions? What the impact of that has been on other crises that are happening right now. And, one of the things that is true about American media, Western media, is that it gets tired of stories well before the challenges of that, right? So for months, it was all Ukraine all the time. It doesn't really show up anymore. And there will come a time when news executives will decide Gaza is just not that interesting of a story anymore. But the people of Gaza will continue suffering. And so how do you think about that issue of global focus, how it draws attention, what impact it has on places that are not getting that attention, and then how do we sustain momentum in action once the attention goes away?
Thank you, and it's really important. And first of all, it's really good to be able to talk about Gaza in pragmatic humanitarian terms, because it's so important. You can't be silent on that issue, but likewise, you can't be silent on issues that we don't even see right now, like displacement in Sudan. Nearly 10 million people are displaced. We're heading to the brink of famine across Sudan. Or the numerous wars in North Africa or the Sahel, right? They're all causing just tremendous suffering. And yes, the news and Americans and everybody have a sense of, I mentioned ADD, but ADD as it relates to sort of conflicts around the world. And there's some things that probably drive what we pay attention to. If there's a large interested population, first of all, geopolitically, if it's really important to us, then it'll get more play, right? So the war in the Middle East is especially in the Palestinian occupied territories in Israel, is like of intense political interest. So that'll be on the map for a while, right? Of course. Ukraine is, right? Because it's the interface between Russia and the United States, the new sort of Cold War as it is, right? But many conflicts we don't even care about. We're not paying attention to. Like, how many of you know that much that happened in, Tigray in Ethiopia, for example, or crises in CAR or things like that? You just don't. They don't get airplay. Now, there's the bad part in that is that it doesn't marshal support for the government to actually sort of fund those efforts as well. Because the U.S. government funds 60 to 70% of international humanitarian aid, so we're a big donor, and we need political power to be able to do that. And so you need people who are looking at all of these issues to really lobby for those resources. And I think that, the bad part is that we take our eye off those other issues, we ignore them, and we really focus both money and press into places that obviously need it, but they're not the only things. The good part is that we have some smart people in the sort of aid and even in government that really understand that we still are investing in that. So investments have really fallen short. They're really not paying attention to those areas in the way they should, but there's some really smart people that are still keeping those on the agenda.
And is it a zero-sum game? Like, is there a certain amount that, like, the U.S. government gives for humanitarian, or NGOs that are funded through, let's say, private philanthropy or European governments?
Yep.
Is there an opportunity to grow that pie, or do you feel like we've hit a point where it's really pretty stuck?
Both. So I think that in the aid world, the pie, there's no reason that the pie shouldn't grow. We give 1% of our GDP in foreign assistance or something. We're an enormously rich country, and we have much more to be able to give if we can. And we can move the needle any time that we want. So the difference is actually politics. I just had a conversation with David Beasley. David Beasley was the former head of the World Food Program, the largest humanitarian aid agency. They truck food all over the world. And David was a Republican who was during the Trump administration. He didn't know anything about the World Food Program, actually, when he became the head of it, but he knew politics. And so he just doubled their budget and saved millions of lives by doubling their budget, right? And so the ability to actually play with politics in order to make that happen is the difference between the way aid budgets rise. But the needs are rising.
Let me stay on this for a second, because it's interesting. One of the things that certainly heard this a lot in the pandemic, we hear a lot in public health, is we got to get politics out of public health. And what I'm hearing is maybe we don't have to get politics out of public health. Maybe that's the wrong way to think about it. We're not talking about partisanship. We're not talking about you got to be more hyper-partisan. How do you think about that intersection between, we can talk about politics and humanitarianism, politics and public health more broadly. How do you think about it? What should we be teaching our students about this? How do we be more effective in engaging in that topic?
Yeah, it's really important to actually, it's a sense of helplessness on the humanitarian side if all you're doing is trying to put out fires that the world is igniting every day. And at some point, we need to actually be an advocate for political solutions. So we have got to intensely involve politics in the humanitarian sector and in the development sector, because these issues can't be solved by humanitarians putting out fires as much as we want to spend.
Yep.
It's incredibly important life-saving work, but we have to engage policymakers and really intelligent, proactive outreach to, nations all over the world. Peace is what we need.
And my sense is, and I suspect you agree, that we've got to train our public health people to become more effective at doing that in a way that I think at times public health schools have sort of shied away from, because they're like, that's politics. We do science. Turns out public health probably is that intersection between the science and the politics.
Well, and the conversation around Gaza has been very interesting about that, right? Because it scared people to talk about these issues. You're scared because your words can be twisted and all of those issues. But it not only just the war in Gaza or the war in Ukraine or the war in Sudan or South Sudan or around the world. We have to talk about it. We have to be advocates. We have to be activists to some degree. But our activism is not politically aligned. Our activism is political engagement to actually sort of stop these conflicts. So I agree with you. And I think also, you bring, and you have in your tenure at the school, has brought pragmatism to public health, because we can't sit back and do studies. We need to do studies. But we
Those of you who are researchers, please keep doing the studies.
Yeah, we're in. Right, but you've got to translate it, right? And translate it, as you've done really well in COVID, et cetera, in policy, translate it in engagement, translate it in activism.
All right, a couple more questions, then I'm going to ask Craig to come up, and he has some questions. And if folks have questions, we'll switch to the audience as well. So we've been talking about the shifts, and I guess I was hoping you could talk a little bit about, it's interesting, in the conversation we had back there, you talked about these moments in kind of moments of crisis over the last 30 years, whether that's Sudan, whether that's, or South Sudan, whether that's Rwanda, whether it's the tsunami. There have been these events that have changed humanitarian response. Can you talk a little bit more about what causes certain events to change the broader thinking about this? And then draw the line out beyond where we are to answer the question, think about the future. Does Gaza do that? And what does humanitarian response look like 5, 10 years down the road?
Wow, yeah.
And 45 seconds.
Exactly. So I think that, to frame it, if you think about the arc of history being defined by certain sentinel moments, we all know what they are. World War I, World War II, maybe the Vietnam War for the U.S., for example, or certain big sentinel, the fall of the wall, the nuclear age, all of those things are big sentinel moments that the world was different after they happened. Things led up to those. They happened. They were a landmark moment, and the world was different. The aid world is very much like that, and very much driven by conflict or big sort of disaster moments. So, the Nigerian civil war that happened when Doctors Without Borders split off from the International Committee of the Red Cross created a fundamental difference in the way organizations think and look at each other. Rwanda and the genocide of Rwanda was an abject failure, both politically and also from the humanitarian aid world, but it led us to realize that there had to be standards in aid and professionalism. And so there's many different sort of events that have happened that in the aid world, the humanitarian world, we've realized, we've got to do something different. And we've been reactive. We as an aid agents, a sector, the $20-some billion aid industry, has had to be reactive. But also has improved considerably because we've become more professional, more proactive, more engaged with other sort of sectors of activity, more likely to be involved in politics, all of those issues. What Gaza means is not clear, actually. I think what it means to me is that it once again throws into sort of sharp relief the need for diplomacy, and you can't depend on aid because there is no access, or there's very incredibly restricted access. So to say that the humanitarians are going to come in and somehow help is naive, right? We can come in and save some lives if we have access, but the fact is, it needs to be a diplomatic solution. And maybe this will be another example that in order to save lives, we need a true diplomatic engagement and solutions, because that's what's going to do it.
And do you think the humanitarian community, though that too, the set of activities, the programs, do you see it looking very different 5, 10 years down the road, or is that hard to?
No, there's some really interesting things that you wouldn't, most people don't know about, and Craig and I, we teach courses, so we have to keep up on this stuff, right? But like, for example, 60% of humanitarian aid is in cash now. So it's not in stuff. You're not delivering jerry cans and buckets and medicines and stuff like that. It's cash. And cash was never really accomplishable without an iPhone or some sort of a device, because you don't give people buckets of cash. It creates really incredible vulnerabilities. But we can give from New York or Washington or wherever our organization is, we can directly fund a widow on the Kenya-Somalia border that has been identified as vulnerable. We can give her $100. And that $100, she can do exactly what she needs to do with it. It's incredibly powerful. So just cash assistance and the ability to use digital cash has been transformative in the field, because it supports the local economy, it gets to the right people, it cuts out many middle persons, and it's really effective. There's, the ubiquity of digital technology has made everything different. So that it's been really promising to see that. So that's one example. And I think the aid world is going to have to adapt to many things, and the good and the bad of technology, disinformation on one side, but access on the other. So there's some really interesting things that will happen. I think the future of aid is going to look like the better use of technology and digital cash is going to be one. Localization, in other words, having people really do their own work even under extreme duress, still empowering people to do their own work. Decolonization, which is actually getting them to spend their own money, which is a whole harder thing to do, right? But the future is pushing towards that as well. And then, maybe breaking up these incredibly large, important non-government organizations that do tremendous work, but to make their work really translate to the field better. So I think there's some promising work to be done, and really interesting things out there, and I think the aid world is going to adapt.
I like it. All right, I'm going to call Craig up, and as I am, I'm just going to ask you one last question, which is, okay, so we have students in the audience. We're videotaping. There'll be students who will watch this. For a non-clinician, or it could be a clinician as well, but as a master's, a public health student, who wants to go into humanitarian work, who is driven by the notion of being effective. Advice, beyond getting their master's.
Yeah. It's a phenomenally interesting field. Honestly, it's a phenomenally interesting field. We were talking backstage a little bit about when you're in the aid sector, the humanitarian aid sector, you're literally witnessing history happen. And it's a privileged position to be in. And it deserves professionalism. It deserves you knowing what you're doing, whatever sector you're in, whether it's an engineer or a public health expert or a physician. And so what I would do if you have an interest in this field is go at it and learn about it. Talk to people like us. Understand the pathways. Most of humanitarian assistance is not from doctors. Most of it's from engineers, from business managers, from logisticians, etc. So find your place in it. Get to know the field. Be bold about sort of stepping into the field because we need it, and we need professionals in it.
Awesome. Right.
Thank you, Dean Jha and Dr. Van Rooyen. I appreciate this discussion. Gave us a lot to think about. If you have questions, please raise your hand. I'd like to take just a quick moderator's prerogative and ask a quick question, Dr. Van Rooyen, that I've been thinking a lot about and that you started to nod to. And I would like to channel some of Dr. Sarkar, Malavika Sarkar's energy from the Consortium of Universities on Global Health, which she put together a day for about a month ago. And the idea was flipping, the power structures, the money from Global South to Global North. And you mentioned that there are really big NGOs. One of the ones I work for, Doctors Without Borders, is $2 billion, 7% of all humanitarian funding. 5 top NGOs are like 25 to 30% of all humanitarian funding, despite the fact that 90-something% of NGOs are all local. And a decade ago, humanitarians committed to this World Health Assembly, we're going to decolonize, and we're going to change who makes decisions and where the power comes from. And I'm curious your reflections on how that's happened in the past decade, and how do you think that's going to happen? Divesting power, even within our own organization at Doctors Without Borders, has been very, very, very difficult, and shifting that from 5 European capitals to the field has been impossible, it felt like at times. So I'm curious your experience looking back over the past 30 years, looking for the next 5 or 10 years. How are we going to change that power dynamic, and who makes decisions in humanitarian response?
Thank you. Really interesting question. We talk about this a lot, and I think in global development, it's easier to conceive of decolonizing global development because there you just have to change the way that the money lands and the control of money, even getting sort of, the countries that are going to be recipients of funds to still kick in, right? So the ability to actually have a much more organized global fund for development is actually plausible and can happen. That has to be matched with what we call localization, and that is capability and capacity building for local organizations to be able to run their programs, do their programs, study their work, do the research, etc. That's happening, and it's happening probably slowly, but it's still happening. It's really hard in the aid sector because you've got places like, how do you build local capacity in Haiti right now, right? Where the airport's closed and there's virtually no access and no organization that can handle being there aside from just a couple, right? So how do you do that in a place like Haiti or Yemen or a place that is intensely conflicted? It's really difficult. So a lot of aid has been sort of shifted because most of the aid actors in the world are national staff, even with MSF, et cetera, right? The vast majority of people who work in the field are national staff. They just work for a bigger central organization. And the idea of building local capacity just takes a lot of effort and time, and it's challenging in humanitarian contexts. And then the big question is, how do you flip the money? And we're just still not there. We're not equipped yet to take large pots of money from the US or European donors and just like delivering it to places that don't have the capability to spend it in the way that probably needs to be spent. But that's a super paternalistic attitude, right? So we're going to have to find a way through that.
Absolutely, thank you.
I wanted to thank both of you for doing the work that you do, and Ashish, for your thought leadership and for coming back. We're so lucky that you're here. Because of my relationship with Dr. Barnes, I could tell you that I think this exceeded any kind of thought that it would go this far and influence this many people and make students as mindful as they are. I have a practical question, though, which is that in Gaza, I don't get two things. Where's the UN in all this? And is it UNICEF that provides humanitarian relief? But number two, it seems to me that hospital ships offshore would be a very practical way to provide aid to people who need it and to reduce the number of casualties and the exposure that people, humanitarian doctors have when they go into places like that. Not possible in places like Somalia and so forth, but have you looked at that and so forth? And just curious what your response is to that. Thank you.
Thank you.
I'm curious about the role of the UN in a lot of these conflicts. Again, I do think you should talk about Gaza too, so I don't mean to generalize it, but I think it is an issue that comes up a lot is where's the UN, where's WHO, where are these more formal multilateral organizations, and what are their limitations that essentially create the need for NGOs that we see?
Yeah, and so the UN is a big thing, right? The UN is not just one organization, and so the organizations that play a major role in the humanitarian community are UN OCHA, the Office of Coordination of Humanitarian Affairs. Not a large office, but they're the ones that will negotiate access to get in. And then organizations like WHO, not largely funded organizations actually. They help with policy and they move some things along. Or WFP, World Food Program, a huge provider of aid with a lot of logistics capabilities. So the UN itself is very different from, agencies are different from each other. They suffer from the same significant restrictions. They're probably farther in than most non-government organizations who can't get access. When we say NGOs, we mean Doctors Without Borders, Save the Children Care, Oxfam, those big organizations. They can barely get any access. A few of them have access. MSF is one and a few others. But it's so constrained. And the UN plays the role mainly of like gaining access, negotiating with actors, and getting in. Unfortunately, the access restrictions in Gaza are intense and extremely, extremely limited. And so even organizations like UN OCHA and others who are trying to negotiate access for everybody to get in are unable to do so. And then, unique resources like offshore issues, they require a whole different level of cooperation from a warring party, right? And so those are not typically practical alternatives in an active conflict setting. What's the most practical alternative is to preserve hospitals and healthcare facilities from being bombed and attacked, which, as we know, has been a significant feature of the war in Gaza right now.
Thank you. Do you have any other questions?
Thank you very much. I'm Malavika Sharkan. I'm from Bangladesh. And you know about the Rohingya refugee humanitarian crisis in Bangladesh since 2017. So I have two questions. One is that in Rohingya refugee, now all the funds are drying up because they are saying that it's already 7 years and those refugees are stuck up because there's no diplomatic solution between Bangladesh and Myanmar. So my question is that how long the humanitarian aid can continue in a refugee situation or humanitarian crisis? And second is, how much it is influenced by this media? Because I think Dincha said one thing that why there's no camera, there's no crisis. So how much, at the global level, that how much money and how much support will be there is influenced by those media coverage. Thank you.
Thank you, and really interesting questions. The first is the duration. Most humanitarian aid actually goes towards protracted crises. You know, the average duration of a refugee displacement is not a month, it's not a year, it's almost 20 years now. So the likelihood of many protracted crises, Cox's Bazar is a good example of one, that where the Myanmar refugees have crossed, and there's over 1 million people in this area, and there's no political solution. And so it is a chronic humanitarian crisis, and it lasts a really long time. And most of the aid that we are distributing around the world are focused on just longer-term protracted issues, like in the Democratic Republic of Congo and elsewhere. To your second question, the role of the media is interesting, right? Because the media can help marshal public support, and sometimes it marshals public giving. So in other words, just donors do it. But the public contribution is very small compared to the government contribution. So the real effect that the media has is the way that you would engage with your elected officials to pressure them to fund things like the bill that passed in order to fund the war in Ukraine, for example, or things like that. So the real influence is not necessarily compelling people to give more money, it's compelling them to talk to their elected officials to give more money. And that's really the benefit of having really important sort of public relations. And as you know, I mean, most of these are forgotten. Most of these are not addressed, and most are unable to be brought to the public, and the public is weary of many of them anyway.
So can I ask before you, just to build on Malavika's question, the first one, it is, I mean, certainly I see it again as an outsider, not in-depth as the way you do, Mike, that some of these crises, some of these refugee camps or places where people are, generations.
Sure.
That strikes me, I mean, obviously, providing care for people, providing food for people, like that is essential and important and life-saving. But it also feels like that is a problem. Like that is, I get that we need a political solution. And I guess the question is, what is the obligation of the aid community to help create that long-term political solution? I'm going to ask a provocative question that may not be right, but to what extent is the aid community contributing?
Of course.
Because by creating this, you're essentially making it easier not to have a political solution. At least the superficial analysis might suggest that. I may be wrong on that. Help me think about the issue of the longevity of these crises and the role that the aid community is playing, or should be playing, to get to better, faster political solutions.
Yeah, it's really interesting, and your point is a really good one, the degree to which the aid community is complicit in sort of helping preserve and keeping populations who have migrated in a particular area, right? So the idea that the aid world, they're not there. The aid community can't create a political solution. They can't do it. What they can do is say, look, we've got a displaced population that needs services. They need food, water, sanitation, housing, all the stuff that they need in a refugee camp, and it's not ending, and there's no end in sight. So one thing they do is that aid saves lives, but it also cements those people in that area as well. And without a diplomatic solution or some other solution, it can't really move forward. And we see a lot of places that are stuck like that.
You want the aid community to do something differently? I mean, it's hard to take people who are starving, people who need healthcare services, and say, we will not provide that because somehow that will get us to a faster political solution. Feels pretty untenable, pretty unhumanitarian.
Yeah.
So what do we do?
Well, I mean, let's take one of those large refugee camps on the Thai-Burma border that have been there forever, or in Cox's Bazar. Those huge places, there's 1 million people to move. Where are they going to go? So there's not a solution. So then, and the aid community says, well, we want to have schools for kids, and we want to have, opportunities for people to build their livelihoods and to actually make money. And then there's markets. And then is there plumbing? And is there building? And is there a city of 1 million people that you're building? So at some point, it is a big problem that stabilizing a population can cement them in place. I don't have a solution for it aside from, really proactive governmental participation in order to make sort of create a solution.
Thank you.
Thank you so much for coming to speak with us today. My name is Parisa. I'm a second-year MPH student. You spoke a little bit about the changes that you've seen over the years in the treatment of humanitarian aid workers and just your ability to access places and the increased targeting of people that want to do humanitarian work. And I was curious if you saw a solution to the increasing politicization of humanitarian aid, and also if you had any advice to people who wanted to do humanitarian work or humanitarian medicine in light of the current context of humanitarian aid.
Yeah, thank you. I'll start with the advice, I suppose, and that is that most of the aid efforts that we engage in sort of conflicted areas or contested areas, a lot of the work, sort of home-based stuff, is done off-site. So, for example, instead of being in Iraq during the war, right, you might have been in Jordan for some time, and then you are doing some of your time there. And I think there are many places around the world that aid actors can work and do well and have access. So I don't want to paint the picture that it's so non-permissive that it just is a non-field, right? You can actually embark on that as a field and really gain access to places. But it is more complicated than it was. I don't see the genie getting back in the bottle, unfortunately. I don't see somehow the world realizing that we really are civilian do-gooders and we are not politically aligned. I don't see that changing. I see it, if anything, it will continue. And I think the humanitarian world has to be very explicit about its separation from military assets, from government assets. But we work under the principles of neutrality, impartiality, humanity, independence, and those are like cemented in us as humanitarian principles. But because we're funded by the U.S. government, because we're funded by donors, because we are on one side of the conflict versus another, we're increasingly seen as not neutral. So it's actually really hard, and I just think we have to fight for that distinction from governments, and then really look at those future progressive things we can do, like build localization, build local capacity, build those partnerships, build the organizations that are going to be doing this work on the ground with their own communities.
Great, thank you. I think we have time for one more question.
Thank you so much for your time and for speaking with us today. I'm really learning a lot from this conversation. I'm Nithya Ramesh, and I'm a dentist, and I work in global health. And from my experience in global health, specifically in India and Kenya, I've found that one of the biggest roadblocks has been from the local government or not getting buy-in from local politicians. So do you have any actionable steps that we can take to get buy-in from the local government to make them stakeholders and be participating in the aid or the public health effort?
Yeah, I think you're answering your own question, because you've felt it and you've done it, and the barriers of you can do really wonderful work with a progressive government, a progressive local government, and you could be completely ineffective when you have somebody that is either trying to extort the organization or is not permissive or has other motives. And so I think, just as you say, it's got to be locally based, it's got to be politically engaged, it's got to be engaging and educating people. Like, a lot of the work that Ashish and many of us have done is try to get ministers of public health and ministers of finance to come to our institutions to work with them, right? Because at some point they got to get it. And they got to get that, like, this can be done in a way, and really to trickle it down to their local governments. But I think you've answered your question, that is engagement is probably the only real way.
And one more reason why the value of capacity building and engagement with local organizations is, if you walk into a crisis, you don't have a relationship, it is going to be much harder to rapidly build that up, to figure out how you're going to influence in a way that's productive. But if you have local partners who understand that community, understand the political leaders, even if you have a difficult one, you can figure out how to work with them more effectively. So it's always harder when you're kind of helicoptering in, even with the best of intentions, and often with the best of intentions.
Great, thank you all. And Dr. Van Rooyen, that was remarkable. I know, as someone who teaches on this, that you could spend 3.5 hours talking about each one of those issues, that we tried to bring some granularity. Who makes decisions? Where does the money go? How do we protect healthcare workers? So I think it's the beginning of a much larger discussion. We are going to continue to have events as part of the Brown School of Public Health for our students and for faculty and for others to continue to discuss these issues. So I just wanted to take this moment to thank you, Dr. Van Rooyen. Thank you, Dean Jha, for leading us through the discussion. Thanks.
Thank you all.
You know, I'm just going to make one quick, I think we have another minute. So Mike and I used to have a show that we had on the road for a while when we were both faculty at the School of Public Health. He's still at the School of Public Health at Harvard, but under our dean, Julio Frank. And we did like 5 or 6 of these to a point where we both agreed we could do the other person's talk, kind of, because we had it down. And what the insight for me from, this is now probably a decade ago when I had more hair, your hair was shorter, if I recall, but was this notion of professionalization. This idea of creating systems in really complicated places and complicated moments. That there is a desire that we have as human beings when you see a crisis to like storm in there and save the day. And there's a little bit of a firefighter crisis, kind of motive. But firefighters over the years have learned that if you take a systematic approach, you're going to keep firefighters safe and you're going to put out the fire much faster. And I think the humanitarian community did not really have that 20 years ago. There is a small number of people who have shifted the humanitarian community to think much more in systems, to think much more in a professional way. And when I think about the 3 or 4 or 5 people who've done that over the last 20 years, Mike Van Rooyen is always on that list. So Mike, thank you for your leadership over the last many years. Thanks for making time to come and spend some time with us today. This was fantastic. Thank you.
My honor. Thank you.